The scapular muscles. This is taken. Scapular muscles. Well, after remove the skin, then we are remove superficial fascia. Okay. So we are taking the incisions. Then after remove the superficial fascia, then deep fascia. Very difficult to remove the deep fascia on the trapezius. That's why it takes more time. So this is after remove the deep fascia, we are identified the superficial muscles, trapezius. And here the lumbar, here the posteriorly latissimus dorsi is there. Here trapezius. After cutting, remove this trapezius lifting, we can identify the two muscles, mainly rhomboids major, rhomboids minor. These two are attached to the medial border of the scapula like this. Okay, origin from the vertebral column, thoracic vertebral column. Next insertion at the medial border of the scapula. Next, after remove these two, then we can identify here deltoid muscle is there, deltoid muscle. After cutting the posterior fibers of the deltoid muscle, then only we can identify the supraspinatus muscle. Supraspinatus, levator scapulae. Next, below the spine, infraspinatus is there. So that we can show now. See, this is a trapezius. It takes origin from mainly occipital protuberance, ligamentum nuchae, spine of the cervical vertebra, spine of the thoracic vertebra. Next, see, it is going to attach. There is a downward fibers are there, horizontal fibers, upward fibers. So upward fibers, they are going to insertion at the spine of the scapula. Okay, now after remove this trapezius, then we can identify the below the rhomboids major and rhomboids minor. For that, I told already, just 1 inch away from the origin you cut. So now I am cutting this. Okay. Now I am lifting this trapezius. See here, between the muscle there is a fascia is there. That is the identification feature to differentiate the one muscle to other muscle. This is a trapezius. Then below we can identify the rhomboids major, rhomboids minor. See, we are separating, no? Rhomboids major, rhomboids minor muscles, two muscles. Then below, this is the spine of the scapula. We can feel spine of the scapula. So now I am separating deltoid muscle posterior fibers. See. Now cutting here. So now lifting posterior fibers and lateral fibers of the deltoid. So now we are identifying here infraspinatus. See, this is a supraspinatus muscle above the spine, below the spine, infraspinatus. We can remove this fascia, then easy to understand supraspinatus muscle. So, above the spine, this muscle is the supraspinatus. Below the spine is the infraspinatus. We can remove this fascia. What about this muscle? Latissimus dorsi. See, here one triangular area is there. Triangle of auscultation. See, medially this is a trapezius border. Laterally, see, inferiorly latissimus dorsi. Laterally, what is this? Middle border of the scapula. Here there is no muscle. Only ribs are there. Dekho, ribs. If we keep finger, it is going directly. Just very thin muscle fibers are there, intercostal muscles. That's why I told you point blank. That bullet directly enter into the lungs. Dekho, between the space. But whereas here, trapezius is there, rhomboids major, minor, erector spinae muscles are there. Muscles are there. Okay, this is a auscultated triangle. Next, now I am separating latissimus dorsi. Where it is insertion? Latissimus dorsi? Bicipital groove. Medial lip of the bicipital groove. This is the latissimus dorsi muscle. This is the infraspinatus. Where is the rhomboids major? Teres major and teres minor? That is here. You have not did the dissection properly here. When you are updated only, you can understand this. This is the rhomboids, teres major, teres minor. So, lateral border of the scapula attached by the teres minor, teres major muscle. Next here, latissimus dorsi muscle, rhomboids major, rhomboids minor. Next, supraspinatus muscle, infraspinatus muscle. So how to differentiate supraspinatus, infraspinatus? Spine of the scapula. Above the muscle is the supraspinatus, below the muscle is the infraspinatus. This is the trapezius. So after remove the trapezius, immediately what you are identifying here? Rhomboids major, minor. And also here, superior angle, we can identify the levator scapula muscle also there, I think.
Levator scapula. Angle on.
Then we can identify. The superior angle attached by the levator scapulae. Next, teres, rhomboids major, rhomboids minor. This is the medial border. Inferior angle attached by latissimus dorsi. Lateral border attached by teres major, teres minor. Next, spine lip. It is attached by the deltoid muscle. After lifting the deltoid muscle, infraspinatus. Above the spine is the supraspinatus. These are the scapular muscles. You know that what are the actions? Rhomboid is major, minor for the retraction, protraction for the serratus anterior, as well as this teres major and minor. And shrugging action, nay, trapezius upper fibers. So like that. So tomorrow, if we cut this muscle attachment, the scapula come outside. Anteriorly, sternoclavicular joint. So there is no joints. If we cut that, upper limb, whole upper limb it come outside. Dislocation. Tomorrow or day after tomorrow we can do that dissection. What is the nerve supply? What is the nerve supply?
cutaneous.
नहीं nerve supply क्या है? 11th cranial nerve, spinal accessory nerve, spinal accessory nerve. That is going to supply to the trapezius as well as the sternocleidomastoid muscle. So this, if you trace this neurovascular bundle, we can identify. If you trace here, this is a neurovascular bundle going to supply to the trapezius. Neurovascular bundle is going to supply to the trapezius muscle. After lifting this muscle only we can identify. Now vein artery. This is a neurovascular bundle. Okay. Chalo, thank you. So